Good afternoon, everyone. Today, we're announcing another sad record as far as the number of new cases of 19 in the state go, with 3,778 cases reported today. We're also unfortunately announcing the deaths of 29 South Carolinians. And while we're here today to provide an update on the COVID-19 vaccine, which is that true light at the end of the tunnel, I do want to remind everyone that healthcare officials here in South Carolina and across the country are concerned about these devastating numbers that we could really be seeing in the coming days and weeks. Now we want to remind everyone that the safest way to celebrate the holidays is to stay home. We can't stress enough how much individual actions impact the spread of this virus. So please stay home. Wear a mask if you need to be in public. Physically distance yourself from others by at least 6 feet and limit contact with those people outside your household. This week was a momentous week for our country. On Monday, states, including South Carolina, received their first doses of COVID-19 vaccine. And from Monday to Wednesday, our state received 42,900 doses of the Pfizer BioNTech vaccine. And the first shots were administered into the arms of those frontline medical workers who have worked so hard and so long to take care of all of us throughout this terrible pandemic. 15 different healthcare facilities received doses directly from the federal government. And as of today, we can report that more than 7,000 frontline medical workers have been reported in the state as having received their first doses of COVID-19 vaccine. Those who can currently receive the limited doses of vaccine that are available are outlined in our Phase 1A guidance. It was carefully developed based on recommendations from the CDC, as well as from South Carolina's Vaccine Advisory Committee, which helps ensure that our vaccine planning is specific to serving the South Carolina populations. So the over 7,000 medical workers who we know have received their first dose already this week will need a second final dose of the vaccine 21 days after that first dose. The federal government is reserving the second doses for all those individuals that they will need to ensure that they do have vaccine available when it's time for them to be given their second dose and fully vaccinated. So they'll receive their second dose from a future allocation that is specifically being held by the federal government, and will specifically be sent targeted for them 21 days later. So South Carolina, like all states, is going to continue to receive weekly allocations of vaccine from the federal government. We anticipate receiving the next round of allocations early next week, most likely beginning on Tuesday. We won't know the specific number of doses until they're received. But these doses will go to the same acute care facilities that received vaccine this week so that they can continue to vaccinate those frontline medical teams that are saving lives. The Moderna vaccine is expected to be issued its emergency use authorization any day now, possibly as soon as later today. And we anticipate receiving a total of 200 to 300,000 doses of vaccine, including both the Pfizer and Moderna ones, by the end of the year. And again, these are all first shot doses. These individuals' second vaccines will come from a future allocation that is being held by the federal government until that time. We will continue to provide regular updates on vaccine in South Carolina. We're currently developing the best way to visualize and display that vaccine data online. We plan to have this new data set online by the beginning of January. And until that's finalized,
Wow.
we got some background noise. Thanks. We plan to have this new data set online the beginning of January. And until it's finalized, we will continue to keep South Carolinians updated on the vaccine by way of providing updates to you all, our partners in the media, as well as online on social media and through the community level meetings and events that our staff continue to attend to provide important information. So thank you, and I'll turn it back over to you, Laura, for questions.
Thanks, Dr. Traxler. I appreciate the update. Just a quick reminder, please make sure y'all stay muted, please, so we can get a clear recording. And with that, I'll go ahead and begin answering as many of the questions that y'all sent over as possible. A lot of you sent the same ones. So Dr. Traxler, Stephen, and Dr. Kelly, one of the first questions is that Phase 1A includes frontline medical workers, as well as long-term care facility residents and staff. How many long-term care facilities residents and staff have received their vaccine yet? And if not, when will they receive those? And what is DHEC's role in making sure those facilities receive vaccine?
Sure. So it's Dr. Traxler. I can take that one. We have opted into the federal pharmacy partnership for South Carolina with long-term care facilities. So the federal government arranged a program through CVS and Walgreens, whereas those pharmacies will be administering the vaccines to the residents and staff of our long-term care facilities. We have allocated, at least at the beginning, the Moderna vaccine that we'll be receiving to that program. And we anticipate that will begin. Obviously, they still have to get their EUA, and CDC has to provide their recommendations. But we anticipate that vaccine will start being administered in South Carolina the week of December 28th.
Thanks, Dr. Traxler. Another question is, when do we anticipate that all long-term care facility residents and staff could receive their first vaccine?
This is Stephen. I can try to address that question, Dr. Traxler.
Sure.
So, as long as there's no changes in the number of doses of vaccine that's going to be allocated to South Carolina, and again, pending an EUA being given in the coming days, and then also hoping that our inventories and our allocations are going to come in at a good rate. We anticipate that residents and the staff in those long-term care facilities could receive their first dose of vaccines, within 3 to 6 weeks. And this is going to be dependent on the CDC's long-term care facility partnership. They're going to be working on a cadence with those long-term care facilities. They've already been bringing on additional staff to help with the resources that are going to be needed to perform these clinics for those, not only the residents, but also the staff. So we anticipate that it's going to take somewhere between 3 to 6 weeks for them to get through those clinics for the skilled nursing facilities, and then start working with the community residential care facilities. And then the second dose will be 28 days later, which the long-term care facility partnership will be getting Moderna vaccine. So that is a 28-day interval, which is different from the Pfizer vaccine. Thanks.
Thanks, Stephen. A follow-up question is, what made the decision for DHEC to choose the Moderna vaccine for the long-term care facility program?
Yeah, so I can take that question too. So we looked at the number of what we were planning for with allocations, and the number that was going to be needed to fulfill the orders for the federal partnership. And we felt that the number that we had with Moderna was we would be able to meet the number of doses that are going to be required for those long-term care facilities, for the residents and the staff with the Moderna product. And in addition to that, we also were considering the shipments of how the Moderna product is stored and handled. It's a frozen product, but it can be stored for up to 30 days. And so this would give those facilities, which are going to be mobile, more ability or better ability to transport those doses. They're less fragile, there's less involved. You drop the vaccine directly from the vial. There's no mixing in of the vaccine with the diluent or saline solution. So we felt that it would be easier for the facilities and easier on the partnership to handle and minimize waste. And the vaccines we felt would be available as long as EUA is approved. Thanks.
Thanks, Stephen. Also, we've been hearing that the vials are having a little extra amount of vaccine in them. And so what does that mean?
I can take that one too. So the EUA speaks to 5 doses. That was initially approved when the EUA was written. Pfizer, however, had spoken to the fact in several of their trainings that they've been having this week and prior to the EUA even, that there could have been potential for a 6th dose or more, 7th dose, as long as that dose comes from the same vial. And so what we found as first allocations were out and hospitals were using those to vaccinate their frontline healthcare staff, that they were finding that there was additional doses that were left as they were drawing the correct amounts from the vials, the 5. They found that there were enough for 6 doses, and in some cases there was even enough for 7 doses. And so we went, of course, and communicated with the CDC and Operation Warp Speed. They came back with the FDA's statement that due to the public health emergency, be sure to use all the available doses, even if it's a 6th dose or a 7th dose that's coming from the same vial. So what you can't do, to be clear, is you can't pull 6 doses out and have a little bit left, but not quite a full 7th dose in a syringe, and then try to pull from another vial to complete that 7th dose, if that makes any sense. So it has to all come as a full dose from the same vial, and that's been blessed by the FDA. Thank you.
Thanks, Stephen. That's great information. Another question we received of the approximate 7,000 people that have received a dose already in the state, are we aware of any serious reactions?
We are not aware of any serious reactions at this time.
Thanks, Dr. Traxler. Another question that we've received is, how are we working? We've mentioned the 15 facilities that are receiving allocations directly from the federal government. How are smaller or more rural facilities, how are their frontline workers getting the vaccine that they need?
Sure. So this is Dr. Traxler. So we, DHEC has received a number of doses to our secure, receiving and storage and shipping location, or RSS. As you all are probably aware, the Pfizer vaccine comes in trays of 975 at a time, which for some of the more rural or smaller hospitals is significantly more than they may need. So our RSS site received an allotment and then is able to divide it up basically into smaller allotments to provide to these more rural and smaller acute care hospitals so that they can vaccinate their frontline staff.
Thanks, Dr. Traxler. Another question is, how are the phases being defined? I know that you all are receiving these questions directly from constituents and partners. Folks have lots of questions about when teachers and school staff will receive their vaccines. And also we received a few questions asking about, I know that the phases that have been provided now are all subject to change, but why Department of Corrections detainees and staff could tentatively be prioritized ahead of others.
If it's okay, I'll go ahead and take that question. The answer is a little bit lengthy, but I want to make sure you understand the situation, that these are decisions that are not made by DHEC in absentia without further consultation. Early on, DHEC consulted the National Academy of Science, Engineering, and Medicine framework. This is a publication, 238-page publication, framework for equitable distribution for vaccine allocation. And in addition, we convened a COVID-19 vaccination advisory committee that consists of about 24 individuals who represent organizations that represent individuals at increased risk for severe COVID-19 disease, as well as some logistics people, as well as medical providers, as well as insurers. Such groups such as AARP or the Office of Minority Affairs. And in that vaccine advisory committee, we reviewed the document I mentioned, as well as a number of other ethics documents and evidence-based documents to try and define these phases of vaccine rollout. Now, currently, South Carolina, as you know, is in phase 1A of vaccination, and it will take weeks to vaccinate those in phase 1A, all who wish to be vaccinated. This weekend, the advisory committee, Advisory Committee for Immunization Practices, or ACIP, will be announcing their recommendation for phases 1B and later phases. We at DHEC want to be able to review their recommendations in the light of what we've been working on for months. So we certainly have a draft plan for phases 1B and others, but we want to review all sources of information. Perhaps ACIP will have some recommendations for entities that we had not previously considered. We want to make sure that we make the most equitable, ethical, and evidence-based decision. I understand the questions about when teachers and school staff can receive theirs. And in fact, I was late to this call because I was on a call with school nurses talking about vaccine and vaccine distribution. And I also understand why there are questions about how could the Department of Corrections tentatively be prioritized above others. I'd like you to consider where the biggest benefit, the maximized benefit in reducing deaths may lie. Over half the correctional facilities in this state have had outbreaks of COVID-19, and there have been deaths both among inmates and among the staff that serve in these correctional facilities. It is important that we consider risk in terms of not only individual risk because of medical conditions or advanced age, but also risk among people who cannot socially distance themselves from others. They cannot protect themselves from others. And that is part of our thinking as we consider rollout. Everyone in South Carolina who wants to receive vaccine can receive vaccine, will receive vaccine, but it's going to take some time. And we need to think carefully about the best way to reduce mortality in the state.
Thank you, Dr. Kelly. That was a great explanation. Another follow-up question is, vaccine is very limited. We could be in phase 1A for weeks or months, as you all have previously stated. How will individuals know when the vaccine is available to them?
Sure. Hey, it's Dr. Traxler. I can take this one. We will be providing information as we go along in terms of the groups and the populations that are due up next, and when it is time, and where people can go to get vaccinated, what times of day, what days of the week, all of that information through numerous media sources. You all are huge partners of ours in distributing information, so plenty of it will be going through you all. It will also be in really every type of media. I tell folks we'll be on regular media, we'll be on social media, we'll be on our webpage. And I really want to encourage everyone with our webpage to stay up to date with it. The scdhec.gov/vaxfacts, VAXFACTS. A lot of information, including what phase we're in and for vaccines and which groups are in which phase, once that's determined, will be provided there.
Thanks, Dr. Traxler. Another question is, if after individuals receive the vaccine, they will continue to have to wear a mask and physically distance, what's the point of getting a vaccine, and when can we return to normalcy?
If it's okay with y'all, I'll take that one as well. Yes, people will still need to wear masks, observe physical distancing, avoid crowded indoor settings, and wash hands frequently, even after they've been vaccinated, until enough people have been vaccinated for us to feel safe as a community. The Pfizer and Moderna vaccines are both 95% efficacious, which is excellent. I mean, that's about as good as a vaccine gets. But that still means that the vaccine will not protect about 5% of people who are vaccinated. For example, people with immunocompromised or autoimmune conditions, they may have a lesser response to the vaccine. A return to normalcy is coming, but it's still many months away. I mean, what's the point? The point is to bring a return to normalcy, but it's going to take time.
Thank you, Dr. Kelly. Another question that we've received is it anticipated that the COVID vaccine will become a required vaccine for students?
Hey, it's Dr. Traxler. So I think, first of all, it's very early to start talking about vaccine for students. as this vaccine, neither of these are being authorized for children. The Pfizer vaccine, the EUA and the ACIP recommendations go down to age 16, and for the Moderna, it's expected to probably be 18. So they will be doing clinical trials in children to study the efficacy and safety of the vaccines, but that's not available right now. So I think the answer is still very much an unknown because we're not even at the point of having vaccine available for children yet.
If a frontline medical worker has already had and recovered from COVID-19, would they still be recommended to get the shot if it's available to them in phase 1A?
People who have had COVID-19, it is still recommended that they receive the vaccine. It's been shown in those phase 3 studies that people who receive the vaccine produce even higher levels of antibodies than people who recover from the actual disease condition. In terms of when they should receive the vaccine, it is thought that they are relatively immune to COVID-19 for 90 days after that initial infection. In other words, it is rare to see reinfection during those first 90 days after COVID-19 infection. DHEC would like to ask people to consider, since sources of vaccine are still very limited, to consider that if you've recently had COVID-19, recently meaning in the previous 90 days, that you consider waiting until that 90-day point to be vaccinated, and that way make available to more people, to people who are more vulnerable, earlier access to vaccine.
Thanks, Dr. Kelly. Another question we've been asked a lot is, we are fully aware of vaccine hesitancy and people who are skeptical of this. We continue to talk about how this vaccine was developed and held to the same rigorous standards of all vaccines. But would one of you mind speaking to vaccine safety and also how we address vaccine hesitancy, especially among the African American community as well?
Hey, it's Dr. Traxler. And so I think that the best way to address this vaccine hesitancy is to acknowledge that there have been issues and that there are some very real and understandable reasons for why some people do have vaccine hesitancy. You can look at the Tuskegee, you can look at Henrietta Lacks, and those events we definitely need to acknowledge certainly happened and were unfortunate. But they did lead to a lot of the safety processes that are in place now. So there are many checks and balances on these products, these vaccines, as they go through the evaluation process so that similar things don't happen. A lot of this rigorous studying that goes on is established as a result of those unfortunate events in the past. However, these vaccines have gone through all of these rigorous steps and reviews by independent committees, by the FDA, by the CDC, and no corners have been cut in the development and getting to the point of authorizing these vaccines. These vaccines were able to build on research that had been started as early as the early 2000s, back with even the SARS epidemic. And so the scientists were able to pick up some of the research that had already been done in the last 20 years and build on it, and therefore were able to get a head start on this vaccine. And then it was through the wonderful spirit of the American people, including many South Carolinians, that tens of thousands of people volunteered and signed up to participate in these clinical trials in a very short period of time. And so that allowed there to be robust data collected, again, in a very short period of time. Though they still have studied these for 2 months, for a median of 2 months, for safety reasons. And we'll continue to study them and monitor for any adverse effects even after the EUAs are given. So no corners were cut. It's gone through all the same processes and passed all the same tests that all vaccines and medical products always have to.
Thank you, Dr. Traxler. Just a few more logistical questions, and then we'll maybe get ready to wrap up. A few of you had asked that other states have been reporting some delays in facilities receiving vaccine. Are we aware of any shipping delays or shipping issues in South Carolina?
So I'll take this one. This is Stephen. So initially we were told to be prepared to receive vaccine this past Monday. And then what happened as we placed the orders, that we were notified by CDC and OWS that there was going to be a delay. So we did see staggered shipments sent to our sites throughout the week, but we received all of our doses into the state by Thursday. Most of those coming Monday, Tuesday, Wednesday, but otherwise no other delays.
Thanks, Stephen. And another question is, for those who are part of phase 1A but don't necessarily work at a medical facility, how are they getting their vaccine now?
So this is Stephen again. So we're trying to work with folks, entities, if you will. They have to be enrolled. If their facility wishes to receive vaccine, to be able to, and actually in the chat box, I am going to post the link to the COVID provider enrollment page where enrollment is necessary for entities that wish to have vaccine to vaccinate their frontline healthcare employees during this phase 1A. And you will need to make sure that you fill out a section A and or a section B for your sites. You would only fill out a section A. So if you were an umbrella organization, so I'll take for an example a large hospital system, then you would fill out one section A for your organization, and then the locations where the vaccine would go to would fall under as section B locations, and so then only a section B would need to be done for those locations. So if your large entity or your organization has already enrolled, then you only need to do a section B. If you have questions about whether or not your organization has done that or not, you're happy to send those to COVID provider enrollment at dhec.sc.gov, and we have enrollment team that is willing and ready to help answer any questions that folks may have with the enrollment process. I am going to be posting that link here in just a moment in the chat box. Thanks.
And Steve, one more question. I don't know if you have it right in front of you, and if not, I'll follow up with those on the call. Do you have the current number of enrolled providers and then how many are currently activated?
I do not have that number in front of me, but we do plan to be able to provide some of that information here in the coming days. So yes, we can provide that information. Thanks.
Okay, great. I'll touch base with you on that after this, and we'll follow up on this call. We are going to have to wrap up here because I know two of the three of you have a big commitment. Stephen, Dr. Kelly, Dr. Traxler, any final parts for this, any final parting words before we wrap up today?
We just want to remind everyone to stay safe, continue doing what we know works in preventing the spread of this virus, the mask wearing, the physical distancing, and the hand hygiene, and avoiding gatherings as we go through this holiday season so we can all have a not only happy but safe one. Thank you.